Do you know oral health can say a lot on your overall well-being? The inside of your mouth is the perfect place for bacteria to thrive. It is dark, warm, and wet. The foods and drinks you consume provide nutrients for them to grow. When the harmful bacteria build up around your teeth and gums, you are at risk of developing periodontal or gum disease, which is an infection and inflammation in the gums and bone that surround your teeth. Periodontitis is a serious gum infection that damages gums and can destroy the jawbone. At first, it starts as gingivitis or inflammation of gums, but it is already the onset of periodontal disease. In gingivitis, the gums may become swollen, red, or tender and may bleed easily. Gum disease or periodontal disease is a chronic gum inflammation due to infection that requires lifelong care. Sadly, it can only be managed but never reversed. Angelo Mariotti, DDS PhD, Chair of the Department of Periodontology at Ohio State University College of Dentistry in Columbus, Ohio, said that to be considered truly healthy, you don't want to have potential inflammation or infection in your oral cavity. Ananda P Dasanayake, a professor of epidemiology at the New York University College of Dentistry, US, reported that with periodontitis, bacteria and their toxic byproducts can move from the surface of the gums and teeth and into the bloodstream, where they can spread to different organs. This can happen during a dental cleaning or flossing, or if you have a cut or wound inside your mouth, he said. Kimberly Bray, a professor of dental hygiene at the University of Missouri, Kansas City, US, reported that if you have inflammation in the mouth that is untreated, some of the proteins responsible for that inflammation can spread throughout the body. Studies have linked with oral health problems such as periodontal or gum disease to many health conditions, including diabetes, chronic kidney disease, cardiovascular disease, pneumonia, Alzheimer's disease, rheumatic arthritis, cancer, and pregnancy complications. The conditions of periodontal disease weaken the blood-brain barrier and pose a risk for cerebrovascular disease. The condition also causes inflammation in the brain. Kimberly Bray said that periodontitis and diabetes seem to have a two-way relationship. Periodontitis seems to increase the risk for diabetes and vice versa. The hemoglobin A1C or HbA1c test is a simple blood test that measures your average blood sugar levels over the past 3 months. It is one of the commonly used tests to diagnose prediabetes and diabetes, and is also the main test to help you and your health care team manage your diabetes. Higher A1C levels are linked to diabetes complications, so reaching and maintaining your individual A1C goal is really important if you have diabetes. Arwa Banjar et al. 2023 published their reports in PLOS One journal that the periodontitis was found to be significantly associated with elevated glycated hemoglobin levels in patients not previously diagnosed with diabetes, and the elevation in HbA1c levels was more evident in patients with stage 3 and stage 4 periodontitis. The elevated hemoglobin A1c level is significantly associated with the progression of periodontitis and tooth loss. Although periodontitis has been associated with CKD or chronic kidney disease in several studies, the complex pathogenesis of CKD and its close linkage with diabetes and other comorbid conditions means a direct link to periodontitis is as yet not completely clear. In 2020, an international team of experts reported that there is a significant link between periodontitis and increased chances of heart attack, stroke, plaque buildup in the arteries and other cardiovascular conditions. Patients at risk for infective endocarditis may require antibiotics prior to dental procedures. Your periodontist and cardiologist will be able to determine if your heart condition requires use of antibiotics prior to dental procedures. Dr. Frank Scanapicua, Professor of Oral Biology at the University at Buffalo School of Dental Medicine in New York State in the US, said that if a large amounts of bacteria from the mouth are inhaled and settle in the lungs, that can result in bacterial aspiration pneumonia. With the chronic inflammation in gum disease patients, they have a higher chance of getting infected with COVID-19 and their suffering is the worst complication. Researchers found that men with gum disease were 49% more likely to develop kidney cancer, 54% more likely to develop pancreatic cancer, and 30% more likely to develop blood cancers. The bacteria called Aggregatibacter actinomycetum comitans are found in both gum disease and rheumatoid arthritis patients. It triggers the inflammatory autoimmune response of your body's defense system that makes the immune system proteins overactive, thus causing joint inflammation. Studies have shown a connection between bacteria associated with periodontal disease and the progression of Alzheimer's disease, which is a neurodegenerative disease. Gum disease bacteria may be able to travel to the brain and contribute to the development of Alzheimer's disease. The bacteria Porphyromonas gingivitis found in gum disease is also found in the brain of an Alzheimer's patient. A number of studies and reviews have found association between severe periodontal disease and preterm low birth weight babies, though more research is needed to confirm the link. Angelo Mariotti noted, however, that research has not established a clear cause and effect relationship between oral health and many of these conditions. In conclusion, the points can be noted that periodontal disease is not a life-threatening condition. However, it might require you to seek treatments from various medical professionals when the bacteria from the infection spread to your bloodstream to affect your overall health. You cannot cure periodontitis, but you can manage the condition with proper care and maintenance. This includes good oral hygiene and regular dental cleanings at intervals recommended by your dentist. Many of the reviews in this area report that further studies are needed. So, if you want to stay healthy, take care of your teeth and gums.